Our first speaker is Yuefan Shao. She's a doctoral student at the Emory University, a Rollins School of Public Health. She was an actual alumni at the U of M School of Public Health. She'll be talking about social network structures and cigarette smoking among young adults. And then we'll have two other speakers after that who I'll introduce after Iris is done with her talk.
Thanks everyone for coming. And today the talk I'm going to talk about is the social network structure and cigarette smoking among adolescents and young adults. So starting with the background, as we can see from the recently updated data from the National Youth Tobacco Survey, despite the decline in youth use of combustible tobacco products, there was no significant change in teen cigarette smoking from 2019 to 2020. The rates of combustible tobacco use remain concerningly high. Among the younger population who use any tobacco product in 2020, about 42% smoke combustible products. In addition, the proportion of ever smokers who initiated cigarette smoking in early adulthood more than doubled between the year 2002 and 2018. The proportion of daily cigarette smokers who transitioned to daily smoking in early adulthood also increased by about 20% in 2018. Okay. So population level distribution of cigarette smoking, level distribution of cigarette smoking vary largely by population social demographic background, especially among the younger population. Findings from extensive number of sociological and epidemiologic studies exploring the underlying mechanisms explaining tobacco-related disparity among adolescents and young adults have suggested the importance of social network. Specifically, cigarette smoking behaviors have been shown to be correlated within one's friendship network. Exposure to smokers within the social network has also been observed to be associated with a higher likelihood of smoking initiation among adolescents. Most well-known studies linking social network to cigarette smoking among the younger population has been centered around the social contagion theory, social norm theory, and the concept of homophily, where individuals are more likely to emulate the behaviors of perceived friends, and individuals with similar smoking behaviors tend to be within the same network cluster. This dynamic interplay between the friendship ties and smoking behavior has been the foundation for designs for many tobacco control programs targeting youth. However, when thinking about effective smoking prevention measures, we might need to take into consideration the additional pathway linking social network to individual cigarette smoking behavior through social network structural characteristics. And in particular, social network structural properties play an important role in shaping one's perceived network externality prior to decision-making, which is defined as the perceived effect a product has on a user while others are using the same or compatible type of product. So however, to date, there are very limited number of studies actually evaluating the association between social network structural features and tobacco use behavior. A further understanding of such pathway is particularly important when thinking about smoking prevention measures, since network structural properties are key to network dynamics, including signaling, diffusion, which are both crucial to individual decision-making on a social network, as well as information diffusion. In this preliminary analysis, we aim to explore the social network structural characteristics among adolescents and young adults with different cigarette smoking behavior using the AdHealth study Wave 1 and 3 in-home friendship survey. In addition, this association between network structural properties and cigarette smoking behaviors were assessed in both of the waves, respectively. So network structural features of interest include betweeness centrality, local clustering coefficient, and network diameter. Additional centrality measure including degree centrality will also be assessed because that has been a popular research question as in whether popularity is associated with the smoking behavior among young adult and adolescents. So using the AdHealth in-home survey, we constructed several different complete egocentric networks. Existence of subcommunities was assessed using the Loven methods for community detection. Other node-level structural properties were also obtained. Association between network structural characteristics and cigarette smoking were assessed using logistic regressions. At baseline, there were 20,747 individual participants with a mean age of 16 years old, and by wave 3, mean participant age has reached 22 years old. In wave 1, majority of the adolescents were never smokers, whereas in wave 3, only 30% young adults were never smokers. Higher proportions of individuals in wave 3 also nominated a current smoker as a friend within the network. Here you have the overall friendship network with community detection methods, and wave 1's overall friendship network has fewer number of sub-communities. Whereas participants get to young adulthood, the overall friendship network started to form clearer and more sub-communities, suggesting the overall network is now less compact. And now looking at the friendship network stratified by smoking behavior at both waves. At wave 1, there were only about 0.3% adolescents that were current smokers and 3% that were former smokers. Therefore, there was no clear subgroup in either of those populations. And I did not really put a plot here since there was no clear sub-communities. And at wave 1, current smokers, as we can see that the never smokers had 3 distinct sub-communities within the overall friendship network. At wave 3, however, we can see that never smokers exhibit different community structures as compared to former smokers and current smokers. And current smokers and former smokers exhibit fewer number of sub-communities and might be more compact than never smokers. And then the structures amongst the current smokers and former smokers are relatively similar as compared to never smokers. So based on the regressions assessing the association between network structural features and network behavior in adolescents, we observed that the odds of smoking decreased by about 14% for each unit increase in degree centrality. However, we really did not find an association between other structural properties and smoking behavior among adolescents at wave 1. Using similar methods, contrastingly, however, among the young adult friendship network, for every unit decrease in local clustering coefficient, which is a measure about the local level clustering of the social network, there was about 40% decrease in odds of being a current smoker as compared to being a never smoker. In addition, for every unit decrease in betweenness centrality, there was an about 15% decrease in odds of being a current smoker as compared to being a never smoker. These findings indicate that current smoker networks are less compact with fewer friends functioning as bridges between ties among young adult network, which is relatively different from the adolescent network findings. So to conclude, we can see that based on these 2 cross-sectional analyses, the macro level network structural characteristics do differ by age as well as smoking status. In particular, clusters play an important role in differentiating networks among individuals of different smoking behaviors. Individual level network structural characteristics such as betweenness centrality and local clustering coefficient were observed to be associated with cigarette smoking behavior among young adults, but not adolescents. However, there are several key limitations of this particular preliminary analysis. The first of all, there is limited generalizability due to lack of up-to-date data source for population, and there could also be bias due to missing covariate information as well as missing network nodes due to the network survey design. The second limitation is the self-reported measure of tobacco use as well as network ties. So these brings us to the future direction and also the next steps of the research. So for the next step of the research, we might consider missing data imputation on the social network to impute the missing ties and as well as missing edges as well as missing nodes to evaluate the coevolution between the social network structural features and smoking behavior. And then second, we should consider incorporate key network structural features as parameters of simulation models evaluating dynamics of adolescents and young adult smoking behavior, as well as effectiveness of tobacco control measures on a social network. So that's it for the talk for today, and any questions are welcome.
Great. So short and sweet. So we can have a lot of time for discussion. So Ritesh.
Yeah, great work, Iris. This is really interesting work. I think the area of social network analysis and tobacco control is, I think, very much lacking. So it's really, really wonderful to see you take advantage of the AdHealth data to look at this. I think there's a question from the group, from Kara Kiesling. She's asking, does the friendship network that you analyze, does it include siblings, cousins, family members, those types of relations? Or is it just friendship networks?
So based on the questionnaires, we use the in-home survey of the wave 1 and 3. So in this one, so they can nominated friends. However, we do not really specifically exclude the ones that are actually siblings or family members, which I think is worth exploring because the strength of the network ties might actually differ if the person is actually one of those categories. However, we were not able to gain those data from these particular surveys, and we might think about linking it back to the main survey to identify those individuals in the future. Yeah.
Great.
Maybe as a follow-up question, or maybe not necessarily related, but just generic questions. So why are you using AdHealth for this analysis? Why you're not using more recent studies? Yeah, so that maybe you can have.
Yeah, definitely. So I think out of all the data sources, AdHealth is one of the relatively more comprehensive and nationally representative ones, actually, with relatively more comprehensive network information. And also it's really interesting to capture the differences between the network, especially among different developmental periods, for example, in adolescence and adulthood. So that is one advantage of that AdHealth. However, there's a really strong disadvantage is because it's relatively dated as compared to newer data sets such as PATH. So that is why I think for the future studies, we might consider using newer data set and then for simulation models.
But are there any data sets that have this type of information, modern?
Yeah, so I am actually not aware of any. That's why I decided to use this particular data set. Yeah, I don't know. So if any audience has suggestions, I would be willing to take them too.
Well, yeah, I mean, and of course, anyone who knows about good data sources for social network data, I mean, national representative like AdHealth may be a dream, but other sources that would be helpful. I think it's true. There are more, and maybe that's something to highlight and call, like, because I can imagine that the first question that maybe you get when you're presenting these or from reviewers when you're writing this publication is, so what about E6, and is this relevant for the current network structure? So yeah, what would your reply to that, response to that? Yeah, is this relevant for now? A world with E6 and all these new products that are emerging and social media and everything.
Definitely, I think it's a really relevant question, and unfortunately, I think AdHealth started to collecting questions regarding e-cigarettes starting wave 5. So that's one important limitation I should acknowledge. Yeah.
So they have now E6, you said? In wave 5? Okay.
Yeah. In wave 5, they actually added one particular question in their survey about e-cigarette use, but it's relatively not specific, and then does not include other products as compared to other data sets.
Oh, great. There's a question from Mike Cummings. Have you considered using Twitter or Facebook or other social media data to look at this type of relationship?
Yeah, so there actually has been a similar study that's done on Facebook smokers like years ago, I think, as Facebook smoking status. And I did not really take advantage of Twitter or smoking, or Facebook at this point, because I think the online behaviors also exhibit relatively different as compared to these type of longitudinal studies. So I think those data set are really helpful in terms of looking at the online kind of interventions as opposed to the more traditional smoking prevention measures or policy effectiveness. And I think that what I'm interested in is really applying some of the findings here and into the simulation models to evaluate the smoking prevention measures. So I think for the online ones, it might be of interest if we're interested in looking at online intervention design.
Some points of clarification. I should have probably asked this first. I think there's I think the folks that are listening want some little more clarification on the meaning of some of the variables that you're using, like the clustering coefficient or betweenness, centrality, and so forth, so they can better grasp the meaning of your results. I know you went through it and the timing is a little short sometimes, but this is an opportunity maybe to elaborate.
Yeah, so definitely. So in the past studies, a lot of the studies have focused on, the typical centrality measures, which includes integrated centrality here, as well as the closeness centrality. So these are the measures to see how close individuals are within the social network. However, the local clustering coefficient and the betweenness centrality, these are the measures to identify, reflect the node level local structures of the social network, as opposed to relatively the relationship between the ties or the nodes. So here, the local clustering coefficient is the one that reflects about the portion of nodes that are actually friends with each other. So basically how many transitive ties are there within the social network. And the betweenness centrality also reflects how many individuals actually functions as bridges between different pairs within the social network. So overall, we can see how cohesive and compact a social network is with these type of network structural features.
Great. I think Raphael brought this up just a few seconds ago, that these data are a little bit, I guess, old. I want to hear your thoughts about how would you maybe express the value of these results to contemporary times? Would we see similar effects with e-cigarettes or heat-not-burn products, or a marketplace where there's a lot of different products regulated slightly differently? Yeah. Would we expect these types of relationships, or maybe even throughout other substances, alcohol, marijuana? Would we expect similar kind of relationships?
Absolutely. So the data on these type of social network structure and tobacco behavior specifically are limited. However, when thinking about tobacco behavior as a manifestation of individual behavioral choice, we can think about the role of actually network structure and also these type of behavioral choices. So in a lot of behavioral economics and also psychology literature, it has suggested that the network structure is really important in individuals' decision making. And so if we consider that perspective, we can think about extending these type of association into wider range of outcomes, and to see like how this type of structure is important in facilitating the behavioral adoption overall. And in addition, when we think about actually having additional layer of complexity, adding the interventions and different type of regulations and information actually diffuse across the networks of different structures. So that's also is where these structural features can be important and interesting, because the information, not just about smoking, but also about these type of preventive measures and regulations, are also disseminating over this network simultaneously with the tobacco related information from the friends and also other people in the network. So it's important, I think, is to take this piece into consideration.
Yeah, I would say that that's certainly quite true. And it's a shame that in many of the models traditionally, that hasn't been incorporated, right? And maybe it was an issue of trying to use the simplest models, of not having the information available to the modelers to account for peer effects. in a rigorous way. So I think that is quite important. Mike, thank you. And my comments is providing additional suggestions in terms of other data that for you and anyone else working in this area could think about. He suggests maybe contacting the Truth Foundation that is gathering data on kids attempting to quit vaping through their online cessation interventions. They have large samples and are looking at tobacco relevant outcomes. Might be a question of figuring out if they're collecting social network data. And of course, the nice thing about health is that it's within a school, right? So you actually have not only how many friends you have, but you know who, which is very important. Mike also says industry is also collecting lots of data from people purchasing their product via online sites, and perhaps that could be a network to tap into. Quit lines. I think also have online communities set up with adult smokers. I think there's very interesting work that was published a few years by David Abrams and others that were looking at networks of online cessation groups. So those are great suggestions and for you to think about. Let me see if there's any other question, Ritesh. No, I think we're
short on time. So really great work here, Iris. It was wonderful to hear your talk, and this is really exciting work. I hope you carry it forward.